Welcome back to TV5 News at 9. It is time now for Aging in Style with McLaren. Joining us this morning is Dr. Eric Sweterlitsch. Thank you so much for calling in today, Doctor.
Good morning, Colette.
Good morning. We are talking about a very important topic. We're talking about heart health today, and it's American Heart Month. So tell us, how can we work our heart health in right now?
Well, especially now in the COVID epidemic, people aren't exercising as much, getting out as much, and a lot of people have gained weight, and we're all stuck at home, a lot of us, and just eating extra, and that kind of thing has a bad impact on heart health. And that's what we're trying to recommend to patients, to get out, exercise more if possible. Some of the gyms are open partially, but if you're able to, getting out of the house, getting outside and going for a walk is one of the best things that we can do. It's good for our heart health as well as our mental health. And also we want to just really try to watch what we're eating and stay away from processed foods and takeout food and things like that, and try to do more healthy cooking at home.
Oh, those are great tips. And it is so cold now. We're right in the middle of winter with snowstorm coming. What are some other ways, some other tips that you have that we can exercise despite the cold weather and also the pandemic?
Well, it depends on what kind of shape we're in, and we certainly want to be safe. But if you're able to get out and put a hat on and brave the cold, then that's great. Certainly if there's an ice storm or it's really icy, we don't want to fall or anything like that. If patient's mobility is really limited, I recommend to try a stationary bike or even a treadmill at home, or even just walking around in calisthenics at home. Again, some of the gyms are open, like the YMCA. It's limited capacity, and that's something someone would have to decide on their own if they want to venture out with something like that. But I think really getting outside and exercising is the best, if at all possible, if people can do it.
Yeah, definitely.
Luckily,
get some fresh air.
In the winter.
Yeah,
yes.
Yeah, I love that. That's a great tip, Doctor. Also, let's talk about some of the signs and the symptoms of heart attack. I know that they're different sometimes for women and men.
Well, there is a difference, and we always hear classically, if someone's having a heart attack, that it's chest pain, usually left-sided chest pain that can often run down into the arm or up into the jaw, also associated with shortness of breath or sweatiness, nausea sometimes. Those are the classic symptoms of a heart attack, and certainly if someone's having something like that, they need to get medical attention immediately. But people can have different signs, and it's not always typical like that. And women have a higher rate of having unusual signs of a heart attack. So it's not necessarily that classic pain. It could be a pressure or just a tightness, or maybe a shortness of breath. One thing that's really important is, if there is a heart problem, any kind of symptoms that occur in the chest or undue shortness of breath that occur with exertion and are relieved with rest, that's a real warning sign. Symptoms like that in the chest with exercise, we really worry about. That's something to get checked out.
Oh, Doctor, thank you so much for giving us these tips today. We all need to remember this, especially during this time right now. Thank you for joining us this morning.
Well, thank you, Colette. Good to be here.
Of course, you're welcome. And if you want any more information, just head on over to the Aging in Style page. That's on WNEM.com.